Hey everyone, welcome back to IMG Doctor Diaries. Today we're tackling one of the most confusing parts of working in the UK, the NHS doctor hierarchy. From FY1 all the way up to consultant, we'll break down what each grade means, how they fit into the hospital team, and where you might start if you're moving to the UK as an international doctor. Let's get straight into it. First, why does this even matter? When you start applying for jobs or once you get your first rota, you'll see titles like SHO, Registrar, Specialty Doctor popping up everywhere. Knowing what these actually mean helps you figure out which jobs match your experience, what your day-to-day might look like, and how to plan your career in the NHS. Let's start right at the base. Foundation doctors. These are doctors in their first 2 years after medical school in the UK. FY1, or Foundation Year 1, is like an internship. After this, doctors get their full GMC registration. FY2, or Foundation Year 2, takes on more responsibility, managing acutely unwell patients, maybe even leading a small ward round. Most international doctors don't come through this route, but it's helpful to understand where it sits in the hierarchy. Next is what most IMGs will hear a lot about, the SHO level. Technically, SHO stands for Senior House Officer. It's actually an old grade that doesn't officially exist anymore, but hospitals still use it all the time. So who does it actually include today? Doctors taking an FY3 year, trust grade doctors, and junior clinical fellows, JCF. Plus doctors in training at the early stage like IMT1, IMT2, which is Internal Medicine Training Year 1 and 2, ST1, ST2 in specialties like surgery or psychiatry, and GPST1, which is General Practice Specialty Training Year 1. All of these are basically at the same level of seniority. They're doctors who've completed an internship and are learning to manage patients more independently but aren't yet registrars. For most IMGs, this is exactly where you'll start. Why? Because after completing a 1-year internship or house job abroad, you're usually eligible to apply directly for these kinds of SHO level jobs, whether that's as a junior clinical fellow, trust grade doctor, or even ST1 level non-training roles. But here's the catch. To apply for formal specialty training programs like internal medicine training or core surgical training, you'll generally need to have 12 months of NHS experience first, so you're familiar with local guidelines, systems, and can build a UK portfolio. Above that is the registrar level, sometimes called SPR or listed as ST3+ on rotas. These doctors are in formal specialty training from year 3 onwards. They run cardiac arrest calls, supervise SHOs, teach juniors, and prepare for consultant level responsibilities. If you've got extensive experience abroad, you might eventually move into registrar posts, but most IMGs spend some time at SHO level first, to build up NHS-specific experience. Then there's the SAS route, which stands for Specialist and Associate Specialist. Most of these roles are called specialty doctors. They're permanent, non-training posts at a senior middle grade level, often very autonomous. You're not on a formal path to consultant, but many IMGs choose this for job stability or later pursue the CSER route to still become a consultant. And right at the top are the consultants. These are senior doctors who've completed specialty training, gained their CCT, and take overall responsibility for patient care. They lead the team, handle the most complex cases, and make departmental decisions. So, just to quickly recap, FY1 and FY2, newly qualified doctors in foundation years. SHO level includes FY2s, FY3s, trust grades, JCFs, IMT1, ST1, ST2, and GPST1, basically all early stage doctors after internship. Registrars ST3+. In formal specialty training, gearing up for consultant roles. SAS/specialty doctors, permanent senior middle grade posts outside the formal training pathway. Consultants, fully qualified specialists leading the department. For most IMGs, after completing an internship abroad, you'll apply directly into SHO level non-training posts to get NHS experience. After roughly 12 months in the system, you can then aim for specialty training if that's your goal. That's it for today's breakdown of NHS doctor grades. Hope it's cleared up a lot of the confusion. If you found this helpful, give it a like and subscribe to IMG Doctor Diaries for more straightforward guides like this. And if you're wondering where you'd likely start in the UK system or have any other questions, drop them in the comments. Always happy to help out. Also, if you missed it, I've already posted a full video on how to manage a patient with a pulmonary embolism, so check that out next. It'll really help build your confidence on the wards. Thanks for watching, and I'll see you in the next one.